I will start with my story of encounter with UTI. This is far back in the 1980s. My mother was admitted to a major hospital for a minor operation. After that, she had difficulty passing urine, but doctors at the hospital asked her to drink more water, without investigating the cause of it. Repeated consultations with specialists at the hospital did not resolve the issue. The situation got worse and ultimately, she said she wanted to die at home. So ultimately my brother and other family members agreed to take her home. On the way home, as she was crying in pain, my brother stopped the car and took her to a small clinic by the side of the road, thinking about getting some strong painkiller injections. The doctor, who was just a regular GP, at once said, "It must be UTI," and she put a catheter tube in so she could pass urine. My mother's screaming stopped almost immediately and the doctor gave her some antibiotics and everybody was happy. So, the lesson is even the experts look only from one angle, and they don't want to think outside the box. Especially in third world countries. If we ask questions, they may say, "Are you coming to teach me?" I personally have never encountered UTI, even though I have been suffering from type 2 diabetes for more than 40 years. But two of my brothers, who has developed diabetes much later in life, have developed UTI and have to go to the hospital for treatment. The difference, I believe, is that I maintain my blood sugar level much more rigorously, with medication and diet, and try to keep A1C under 6.5, while my brothers go by the doctor's advice and maintain A1C around 7. When the blood glucose level is high, some glucose passes through urine and makes it a breeding ground for bacteria. This ultimately results in a urinary tract infection. UTI is a common issue, especially among diabetics. So if you encounter UTI, maybe it is worth checking whether you have diabetes or pre-diabetes. Consult your healthcare professional before making any changes to your medication or lifestyle. Second thing is that it is more common among women. The most common reason for urinary tract infections, UTIs, is the presence of bacteria in the urinary tract, most often Escherichia coli, E. coli, which typically resides in the colon or rectum. When bacteria enter the urethra and begin to multiply, it can lead to an infection in different parts of the urinary tract, such as the urethra, bladder, or kidneys. Factors that increase the risk of UTIs include diabetes. Uncontrolled diabetes, where glucose is leaking through urine and the urinary tract, is one of the major causes of UTI in both sexes. Higher sugar levels in the urine can promote bacterial growth. Urinary obstruction. Conditions that block the normal flow of urine, such as kidney stones or enlarged prostate, can lead to a higher risk of UTIs. Immunocompromised state. Reduced immune function can make it harder for the body to fight off infections. Sexual activity. Sexual intercourse can introduce bacteria into the urinary tract, especially in women, due to the proximity of the urethra to the genital and anal areas. Female anatomy. Women have a shorter urethra than men, making it easier for bacteria to reach the bladder. Use of certain birth control methods, diaphragms or spermicidal agents, can increase the risk of UTIs. Wait, there is more, but do not forget to hit the like button and subscribe, down below. Menopause. Reduced estrogen levels in postmenopausal women can lead to changes in the urinary tract that increase the risk of infection. Urinary catheters. Indwelling catheters can introduce bacteria into the urinary tract. E. coli is responsible for the majority of UTIs, but other bacteria, such as Klebsiella, Proteus, Enterococcus, and Staphylococcus saprophyticus, can also cause infections. Proper hygiene. Staying hydrated, urinating after sexual activity, and avoiding irritants like harsh soaps can help reduce the risk of UTIs. If urinary tract infection, UTI, symptoms don't improve after 1 or 2 days, doctors typically follow a series of steps to understand why the treatment isn't effective and to adjust the approach accordingly. Here's a general outline of what doctors do in such cases. Re-evaluate the diagnosis. The first step is to confirm that the initial diagnosis was correct. This may involve a more thorough examination, review of symptoms, and medical history. Urine culture and sensitivity testing. If not already done, a urine culture is usually ordered to identify the specific bacteria causing the infection. Sensitivity testing determines which antibiotics are most effective against the identified bacteria. This step is crucial for selecting the most appropriate antibiotic if the initial treatment isn't working. Change in antibiotic treatment. If the initial antibiotic isn't effective, doctors may prescribe a different antibiotic based on the results of the urine culture and sensitivity tests. Assess for complications. Persistent symptoms could indicate complications such as a kidney infection, pyelonephritis, a urinary tract obstruction, or a structural issue. Imaging studies, like an ultrasound or CT scan, may be used to identify any obstructions or abnormalities. Investigate other causes. If the symptoms aren't improving, doctors might consider other causes of similar symptoms, such as interstitial cystitis, sexually transmitted infections, STIs, or other bladder conditions. Hospitalization in severe cases. If symptoms worsen or if the infection spreads, as in sepsis, hospitalization may be required for intravenous antibiotics and closer monitoring. Follow-up and monitoring. Doctors usually recommend follow-up visits to ensure that the new treatment plan is effective and that symptoms have resolved. These steps help doctors manage persistent UTI symptoms and ensure that patients receive the appropriate treatment. If you experience persistent symptoms, it's crucial to follow up with your healthcare provider to determine the best course of action. There are several classes of drugs that can increase the risk of developing a UTI, urinary tract infection. Here are some of the most common. Sodium glucose cotransporter 2, SGLT2, inhibitors. These are a newer class of medications used to treat type 2 diabetes. They work by increasing the amount of glucose excreted in the urine, which can create a breeding ground for bacteria. Examples of SGLT2 inhibitors include canagliflozin, Invokana, empagliflozin, Jardiance, and dapagliflozin, Farxiga. Diuretics. These medications help the body get rid of excess fluid by increasing urine production. However, they can also irritate the bladder lining and make it harder to completely empty the bladder, both of which can increase the risk of UTI. Immunosuppressants. These medications are used to weaken the immune system to prevent rejection after organ transplantation or to treat autoimmune diseases. By weakening the immune system, they can make it more difficult for the body to fight off infections, including UTIs. Anticholinergics. These medications are used to treat a variety of conditions, including urinary incontinence, overactive bladder, and muscle spasms. They work by blocking the action of acetylcholine, a neurotransmitter that helps muscles contract. Unfortunately, acetylcholine also helps to empty the bladder. So, anticholinergics can make it harder to completely empty the bladder, which can increase the risk of UTI. If you are taking any of these medications and are concerned about your risk of UTI, it is important to talk to your doctor. They can help you weigh the risks and benefits of your medication and may be able to suggest ways to reduce your risk of UTI, such as drinking plenty of fluids and urinating frequently. Do not forget to click the like button and subscribe. Up above you see a video related to health. Thanks very much for watching this video. Subscribe to my channel. See you in the next video.